Vaccine need, desire, and eligibility is expanding, but Americans are encountering limited supplies and communication and technology issues, leaving many wondering when and where can I actually get a vaccine? Johns Hopkins Hospital nurse manager Nisa Ernst joins me now. Nisa, it's great to have you back on the show with us. Just give us some insight into what it takes to administer these vaccines on such a large scale.
Yeah, Tim, you're absolutely right. So there's a couple of pieces to this. You have to have a person that's comfortable administering the vaccine, correct? Patient or the healthcare provider has to understand what's happening in terms of the vaccine, side effects, those types of things. And then you'll need a period of time to actually monitor the person who's received the vaccine. And so there's a lot of components you can see there. I have thought through this a lot the past few weeks because there is a lot of demand in some areas, and actually being able to deliver that product is challenging. Our governor has been very broad about who can administer the vaccine, and I think that's great. You just spoke about 50 states with 50 different areas and 50 different protocols. I agree. I think we need to streamline that so that we can have a very solid clinical scientific vaccine distribution.
Given that it's been just exactly a month since we saw the first jabs go into arms, what have we learned about the right way to do this?
So in my experience, the right way to do this is to have an experienced vaccine administrator, and it doesn't have to be a nurse. I know some areas, the EMTs, the firefighters, the pharmacy technicians and pharmacists are administering these vaccines, and that's great. The piece that for this vaccine, because remember, this is new, so people are concerned, and rightfully so, about the side effects that could occur. So it's that monitoring period, I think, that adds another layer to this. And the challenge to that is that I talk to people frequently and I ask them about their vaccine, and they begin to talk about, oh, I'm worried about the side effects. And we have to do a lot of work around, yes, there are side effects, but the other side effect of not getting the vaccine is even more dramatic.
Yeah, I mean, getting this and potentially dying or having long-term effects from COVID-19. What would you say to people right now who are really impatient about getting a vaccine?
Well, one of the things that I've actually done this in a couple different areas, see if your state has a vaccine registry. New Jersey happens to have one. Here in Maryland, the governor is doing a press conference today at 5 o'clock, and he will talk about some further vaccine rollouts. I also encourage people to get on their electronic medical record and send a message to your primary care team and say, look, when the vaccine is available, I'm interested.
We saw earlier this week another grim record here in the United States. More than 4,600 people in one 24-hour period, Wednesday to Thursday, died of COVID. Nisa, give us an update on what you're seeing at Johns Hopkins Hospital.
So, I speak about this frequently, hoping for the best, but planning for the worst. Here in the state of Maryland, the governor has told us that when we hit 8,000 inpatient beds, then we need to go to our next level. The other day, we were at about 7,400. So you can see how close we are. So a lot of the planning that we've done over the past few months is starting to roll out in slow ways. We've turned over some more ICUs into being COVID ICUs. We're also looking at some innovative ICU space for non-COVID patients. And quite frankly, we've also are looking to cut back on non-emergent procedures. Because the challenge is, in a lot of cases, patients that will come in for a procedure will need an ICU bed. And those are in such short supply. So we really need to be thoughtful. And I've spoken about this before, Tim. This is a new place for healthcare providers in the United States to have to be thinking about not having all the resources that they normally have.
Yeah, I mean, it's been like this since the beginning of the pandemic, whether it was
Yes.
PPE or ICU capacity or even just person hours. Speaking of the person hours side of this, Nisa, I'm wondering if frontline workers getting the vaccine in the last 4 weeks, if that has yet alleviated some of the pressure that healthcare workers have faced at your hospital.
I will tell you that one of the things that it has alleviated is the fear of what happens if we have to go work on a COVID unit. People, while they there still is some concern about the side effects of the vaccine. Every single employee that I've spoken to said, Nisa, I am so proud of getting this vaccine. I feel safer and I feel like I can protect my family better.
What's the messaging that needs to happen in order to make people more comfortable with the vaccine?
Follow the science. I think sometimes we're fighting two battles. We're fighting a battle with a pandemic, and then we're fighting a battle with not good information from not good sources. And so I encourage people to go to their local health departments, the CDC. I know things aren't perfect. This pandemic is changing rapidly, but get the right information, because the wrong information is contributing to that 4,600. And that is what is very concerning to me. Speaking
of that 4,600, we look at the charts and the graphs here, and we are still at this surge. And it seems like we are still, in some cases, rising or not even plateauing. Is the surge that we're seeing right now a direct result of people getting together over the holidays?
Absolutely. No question. There's a couple of things that are at play. Again, not good information. People not following their guidelines, which was to not travel, to not meet in large groups, so on and so forth. And so, yeah, that is every single decision that we make as a citizen of the world, essentially, will either move this pandemic forward or move the end of this pandemic forward.
Nisa Ernst, nurse manager at Johns Hopkins Hospital. Nisa, thank you as always for your time and for joining us on Quick Take this morning. We should note that the Johns Hopkins Bloomberg School of Public Health is supported by Michael R. Bloomberg, founder of Bloomberg LP and Bloomberg Philanthropies.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quicktake now for insight in an instant.